Hey everyone, and welcome back to Study Nurse IQ. I'm Jenny, and today we're tackling one of the most complex and misunderstood topics in mental health nursing: schizophrenia. We'll be breaking down the essential concepts, from the core symptoms to the key nursing interventions. Think of this as your personal study session, helping you organize this information in a way that makes sense so you can ace your exams and, most importantly, provide amazing patient care. Let's get started. The foundation: what is schizophrenia? So, what exactly is schizophrenia? It's a complex brain disorder that affects a person's thinking, behavior, emotions, and their ability to perceive reality. It's not just one thing, it's a spectrum of psychotic disorders that can be caused by a combination of factors. The likely culprits include genetics, neurobiological factors, and non genetic factors like a birth injury, a viral infection, or even nutrition. While it can happen in young children, it typically appears in the late teens or early 20s. Before we dive deeper, it's important to know that schizophrenia is just one of several related conditions. Other disorders on the spectrum include schizotypal personality disorder, delusional disorder, brief psychotic disorder, and others that are substance-induced or associated with a medical condition. The nurse's assessment: positive versus negative symptoms. When we assess a patient with a psychotic disorder, we look for two main types of symptoms: positive and negative. Positive symptoms. These are manifestations of things that are not normally present. Think of them as additions to a person's reality. This is a group of words put together in a random fashion. For example, if you ask, "What would you like for breakfast?" and the patient replies, "The nails go, the sun is made of chicken." It's just a jumble. Tangentiality. This is the inability to get to the point of a conversation. A person might start talking about one topic and introduce many new, unrelated ones, never circling back to the original question. Circumstantiality. This is similar, but the person eventually gets to the point. They just provide unnecessary and tedious details along the way. Perseveration. This is the persistent repetition of the same word or idea in response to different questions. Thought blocking. This is when a person stops speaking abruptly in the middle of a sentence, as if their thoughts have been blocked or taken away. Perception is a key part of positive symptoms, and this is where hallucinations come in. This is the misinterpretation of stimuli. Auditory hallucinations, hearing voices, are the most common, followed by visual hallucinations. Negative symptoms. These are things that are normally present but are now absent in the person's behavior. These are a pathologic deficit. Think of them as taking something away from a person's emotional and social expression. This can include a lack of emotion, affective blunting, decreased motivation, avolition, and a lack of speech, alogia. Medications and nursing interventions. The primary treatment for schizophrenia involves antipsychotic medications. These are categorized as typical and atypical antipsychotics, and each type has its own set of side effects that we as nurses need to monitor for. Typical antipsychotics can have serious side effects like extrapyramidal symptoms, EPS, which include pseudo-Parkinsonism, dystonic reactions, muscle spasms, and tardive dyskinesia, involuntary movements. They can also cause neuroleptic malignant syndrome, NMS, which is a life-threatening emergency. Atypical antipsychotics, like risperidone, can sometimes increase blood sugar, while clozapine is associated with a severe drop in white blood cells, neutropenia, which puts the patient at risk for life-threatening infections. As nurses, we have to be vigilant. Here's what comes first. Always have a baseline blood count before starting clozapine and monitor for signs of infection. Our nursing interventions for these side effects are crucial. For dystonic reactions, we administer medication as ordered to reverse the spasms. For orthostatic hypotension, we teach patients to rise slowly from a sitting or lying position. For a patient on clozapine, we are on high alert for any signs of infection due to the risk of neutropenia. For tardive dyskinesia, we use an assessment tool like the AIMS scale to monitor for any changes. Let's test your knowledge with a few practice questions. Question 1. The nurse is assessing a patient with schizophrenia who is speaking in a way that is disorganized and difficult to understand. The patient states, "The sky is blue. The chair is a banana. I'll go swimming in my coffee. The nurse documents this finding as which of the following? A. Circumstantiality. Word salad. Perseveration. The correct answer is C. Word salad. Rationale. The patient is speaking in a completely random and unrelated group of words, which is the definition of word salad. Tangentiality involves changing topics but eventually getting to the point, while perseveration is the repetition of the same word or idea. Question 2. A nurse is providing patient teaching for a client who has been prescribed clozapine, Clozaril. The most critical information for the nurse to include to ensure the client's safety is A. You may experience increased photosensitivity, so wear protective clothing. B. This medication may cause weight gain, so be sure to exercise regularly. C. You will need to have a weekly blood test to monitor your white blood cell count. D. Report any urinary retention or constipation to your healthcare provider. Correct answer C. You will need to have a weekly blood test to monitor your white blood cell count. Rationale. Clozapine carries a serious risk of severe neutropenia, which can lead to life-threatening infections. Therefore, the most critical teaching point is the need for regular blood monitoring to ensure the patient's absolute neutrophil count remains at a safe level. Question 3. A patient receiving a typical antipsychotic medication begins pacing the hallway, rocking back and forth, and reports feeling a sense of inner restlessness and an inability to sit still. The nurse recognizes this as which of the following extrapyramidal side effects? Tardive dyskinesia, dystonic reaction, pseudoparkinsonism, akathisia. Correct answer D, akathisia. Rationale. Akathisia is a state of inner restlessness that can manifest as pacing, fidgeting, and an inability to sit still. Tardive dyskinesia involves involuntary movements. A dystonic reaction is an acute muscle spasm, and pseudoparkinsonism presents with tremors, shuffling gait, and muscle rigidity. I hope this review on schizophrenia was helpful. If you found this video valuable, please hit the like button and subscribe to our YouTube channel, Study Nurse IQ, for more simple and clear nursing content. Thanks for watching.